All right, welcome everyone. My name is Tennille, and I'm one of the full-time dental assisting instructors here at Rogue Community College. I run the dental assisting program over out of the Redwood campus, and I also represent our hygiene program and our CODA accredited dental assisting program. I know many of you are interested in applying because it's application season, so really just wanted to show you a little bit about who we are as a program, answer some common questions, show you our presentation about our hygiene program, our dental assisting program, give you some information about our 2-year cohort, as well as show you our RCC website and how to navigate that successfully as a student in preparation for applying. So I'm going to go ahead and get started. I'm going to share my screen and run through our dental programs presentation here. The way this one works in particular, I'm going to go ahead and leave the whole slideshow up here, and I want to see. Perfect. Can everyone confirm that they can see the slideshow here?
Yep.
Great. Thank you guys. All right. Again, so my name is Tennille. I work for Rogue Community College. We have a variety of dental programs to offer. Just wanted to give a quick shout out here to STEP. We have someone from STEP joining us today. Her name is Isabel. She works in the STEP program. And if you're in our career and technical education programs and you're receiving SNAP benefits, you can qualify for extra STEP support. So just putting that up the screen for you guys, there is a QR code available for you there, if you can see that. I will also put my information in the chat um, at the end of the presentation here, and I can always forward your information on to Isabel as well. They can provide assistance with things like food, supplies for college. So don't miss out on that opportunity if you qualify. Okay, so our programs are all designed to, according to the Commission on Dental Accreditation Standards. So CODA is our accrediting body. We prepare our students for national board certification exams. We provide networking opportunities with the local dental communities, and we provide a 1-year dental assisting program certificate. We also provide a 2-year hygiene associate's degree. So this one is going through the dental assisting one first. I'll run through that quickly and then we'll move on to hygiene. So a dental assistant assists the dentist. We help patients feel comfortable during the procedure by answering common questions they have and building patient rapport. We take and process radiographs or x-rays. We prepare and sterilize instruments and equipment. We take impressions for study models. We provide patients with instructions on oral care. We teach patients appropriate oral hygiene strategies. We communicate with our patients, with our dentists, with our hygienists, with other health professionals, dental suppliers, business contacts, insurers, and perform a variety of office management tasks. So taking phone calls, scheduling, things of that nature. So we offer, our certificate program offers the EFTA certification as well as the Certified Dental Assisting certification. So expanded functions dental assistants perform a variety of tasks above and beyond just assisting the dentist. We can polish teeth, we can make temporary crowns and cement them, we can remove temporary crowns and try in the permanent crowns, adjust them for placement. We remove the cement after the permanent crowns or bridges are cemented. We can also do a variety of orthodontia functions. We can place temporary fillings, polish amalgams and composite restorations, and perform teeth whitening. So just a few extra things there that we get to do. I call it arts and crafts for grown-ups. I did it for 18 years. Absolutely love it. So upon completion of our program, you will have certification that qualifies you to place sealants, retraction cord, and perform soft relines. So those are just 3 levels of certification available above and beyond your expanded functions dental assisting certificate that allow you to perform additional functions. And in the real world, that translates to probably a raise within the office. Dental assistants can also, through other programs, earn their anesthesia and restorative certifications. So there are assistants in the Valley who are actively getting to numb patients as part of their functions. So courses that transfer into the dental hygiene program from the dental assisting program: radiology lecture and lab, medical emergencies, infection control, dental materials, and law and ethics. So there are 5 classes plus labs for a total of 9 that transfer directly from the dental assisting program into the hygiene program. So we have some prerequisites for our dental assisting CODA accredited 3-term course: medical terminology, human relations or Psych 101, first aid CPR. There's a math and a writing requirement as well. Those ones need to be completed prior to admission to the program for dental assisting. If for some reason those ones are not complete, there are occasionally exceptions that can be made, but that would be based on our program director's approval. For those of you interested in the 2-year dental assisting cohort, we waive the prerequisite requirements. They just have to be required by the spring of the 2nd year in the 2-year program.
That means
Okay. So let me speak to the 2-year program really quick, and then I'll move on to hygiene. So our 2-year program is for either high school or adult learners, either juniors in high school or adult learners who have already graduated that want to complete the dental assisting certificate program. I'm sorry, I'm going to go ahead and mute everyone really quick, and I'll run through the slideshow, and then I'll open it up for questions at the end. So for the dental assisting 2-year program, that is for high school students and adult learners who do not maybe yet have their GED, their high school diploma, who have not been able to complete their prerequisites, and they like these. And they also maybe want to work full time, maybe they want to support a family, and they want to spread out the courses over 2 years versus doing it in 3 terms and going full time. If you're interested in that 2-year program, you can stay afterwards and I can give you some more information about that. In the meantime, I'll move on to dental hygiene here, as I know we have a lot of eager students. So our dental hygiene program is also under the Commission on Dental Accreditation for our governing body. We do prepare our students for the national board exams. We had a 100% pass rate on our anesthesia boards this last term with our hygiene class. So super exciting. Every single one of them passed. They were well prepared. So the difference between a dental assistant and a hygienist is the length of the education, the skills and tasks performs. It's a license. You are a licensed dental hygienist versus a certified dental assistant. The supervisory level required is different. So as a dental assistant, we require a higher level of supervision. As a dental hygienist, there is a lower level of supervision required because you are a licensed provider. So these are the prerequisites here for the dental hygiene program. It takes students commonly about 2 years to complete these prerequisites. For the science classes listed above, there is also a prerequisite to be able to take these. I believe it's by 121. And that's more of a general science class that prepares you to take microbiology and anatomy and physiology. So those are the prerequisites. They do have to be completed prior to entry into the program, but they do not have to be completed prior to application. So if you still need to finish some of these prereqs during winter, during spring, during summer term, you can. Although you do get additional points on the application for having those prereqs totally completed. And we'll look at that together when we look at the website here. Okay, so for the selection process, all applicants must meet the minimum entry requirements. There are GPA requirements. Our minimum is 2.5. There is a criminal background check. There are immunizations that are required. There is a urinalysis drug screening. It is a competitive program. Not all qualified applicants may be accepted. It is a points-based selection criteria. So our governing body is CODA. We also respond to the OHA. So we do screenings through verified credentials. That's our system that we use to upload your immunizations, to complete the background check. That must include social security number, trace, state and national criminal background history, sex offender registry check, immunizations, excuse me, and a documented receipt of vaccine or immunity via titer per the Oregon Alert Information System. It's CDC guidelines. So if you have, there is a waiver for the COVID vaccine that is available. There are a couple of waivers available for some of the vaccines. Others are not able to be waived just because of our guidelines and regulating bodies. So Hep B, measles, mumps, rubella, tetanus, diphtheria, and pertussis, that Tdap, varicella, and a TB test. So COVID can be exempted, and we do recommend you get the flu vaccine. This is the cost of the background check and the medical document review. So that is up to the students to complete. We do complete random drug testing, and we check for these things. So the students will work within our clinical lab. We have 10 chairs at our Table Rock campus. It's a beautiful campus, and it provides opportunities to work in a professional setting, to work on live patients, and really get that clinical experience that you need to succeed. You will be required to work on one another. If you are uncomfortable with others working on you, this might not be the right program for you, because you will be someone's patient, as well as having other people work on you. So we will tour the dental program's web page. I'm just going to run through a couple other things here. Before we enter the dental program, we want to ask ourselves a few questions. Can I work with blood and saliva? Can I work in a fast-paced environment? Can I learn quickly by watching and doing? Can I work with little supervision? Can I be proactive, find the next thing that needs to be done without waiting to be asked? Am I detail-oriented? Am I sensitive to others' needs? We do have a clinic dress code. So for our clinics, we require scrubs and clinic shoes that have to be worn. No visible jewelry except wedding rings. Earrings must be no larger than a dime, one pair only in the lobe of each ear. Nothing dangling or otherwise seen as inappropriate for the inappropriate for the profession. No facial jewelry, visible body piercings, tongue rings, no fake fingernails, tattoos must be hidden. So there are some professional requirements that we require every student to adhere to. Along with that, we require a natural hair color. So when you're accepted into the program, we will hold all students to the highest professional standards, because our job is to get you jobs. So for student health and patient safety, you are required to report illnesses or injuries, pregnancies, or any changes to your criminal record. There are certain conditions that will require a medical release form to be signed by your physician. You will be given a form to sign when you report an injury, illness, or pregnancy to the program director. When in doubt, report or ask. So, do you have, as a hygienist, as a future dental assistant, a sincere desire to help people, a commitment to lifelong learning, and a few of these personality traits: enthusiasm, honesty, positive attitude, empathy, and cheerfulness? We are relating to patients all day long, every day. And so it does require an aspect of personability to really enjoy working with the public, to enjoy communicating. We highly encourage everyone to pursue financial aid. I know we've got some financial aid representatives on this phone call specifically, and we want you guys to be able to succeed. We want you guys to be able to pay for college or have college paid for. So it's important to be aware of the costs of the program, to be aware of what your financial aid packages are, and what other options that you have for funding if needed. So to be required for consideration to either apply or be accepted into the program, you must attend one of these mandatory information sessions, complete the online application, and meet all of the application requirements. So prerequisites done by the end of summer term, and you've attended this informational session. So the applications, we're going to need previous dental experience if applicable, score of all of your prerequisites, your application agreements. If you are invited back to do phase 2 of the selection process, there will be a proctored essay that's worth additional points. So you will be notified via your email of your status. Make sure you are checking that email. Keep your RCC contact information up to date through your MyRogue account. Make sure that cell phone number is correct. Make sure that student email address is correct. If for some reason it's going to your spam account, make sure you add dentalinfo@roguecc.edu to your contacts list so it doesn't go into spam on accident. So before we start our next fall cohort, there will be a mandatory information session. I believe we have that scheduled for Monday, September 21st. So if you're accepted, put that date on your calendars for your orientation day. So verification of the required immunizations must be submitted. So all of those immunizations that we've asked or required of you have to be uploaded into our verified credentials service. You'll need to follow up with them directly if there's problems with the immunization requirements being met. I will say that if you call the Jackson County Health and they have a building downtown, they do have either free or very low cost immunizations available. I use their services and I do recommend that. Okay, so for those of you who are applying to our hygiene program or our dental assisting program and you need your verification code for the information session, our code is SCRUBS, SCRUBS. So what I'm going to do next is I am going to go to the dental programs webpage here. Okay. Can you give me a thumbs up if you can see the web page here? Perfect. Okay, great. Thank you guys. So I just typed in RCC dental programs. It pops right up. Click on that and it'll bring you to our RCC dental programs webpage. From the community college webpage, you can type in, search RCC, you can type in dental programs into this informational bar here, and it'll bring up our website for you. So this gives information about both of our programs that we have available as listed on our website. We do have a third program available, but as it has not gone through all of the approval processes yet, it is not advertised currently. So today we're going to focus on running through, first and foremost, the dental hygiene program, because I know that's why a lot of you are here. This is a 6-term program, so 66 weeks with summer breaks. It runs fall, winter, spring, year 1, fall, winter, spring, year 2. We are currently accepting applications for fall of 2026. When you graduate, you will have your associate's degree. So there are not 23, there are 44 prerequisites required with a grade C or higher, 2.5 GPA total to be eligible to apply for the program. We do require you have a CPR card, basic life support card through the American Heart Association only, criminal background check, and a 10-panel drug screen. This is the Oregon Health Authority standard for health professions, student immunizations, and drug screening. So we adhere to their policies. So the scope of practice for the dental hygienist is listed here. If you're interested in what functions that you can perform, that's listed there for you. So what I'm going to do is go to the application and selection process page. So applications for 2026, 2027 are open now. If you have any questions about the application process that aren't answered today, you can contact by going to this website listed right here. You can click this hyperlink. It'll take you right to our email here. Before you start the application, please refer to the RCC Dental Program pre-application procedures. And I'm going to go ahead and click on that because I won't be able to see it under my screen sharing. So this goes through your pre-application procedures. You do have to apply to RCC, talk to your advisors, secure your funding, submit transcripts, complete your prereqs, check your GPA, and submit additional licensure if you have it. Talk about your healthcare work experience, submit the form for that. Verify that you've completed military service if part of your application, and make sure that you can adhere to our technical functions and standards, sitting, standing, working above patients, etc., and that you understand how to use the technology, like the computers used here at RCC. This gives you access and disability resources if needed. So going back here, I'm going to go to the application and selection process again here. So that was the pre-application procedures. Now, we're going to talk about the application ranked via a two-phase point system. So for phase one, we are looking at GPA. We are looking at the GPA specifically of the science courses and a handful of other things. So the science grades, you can earn up to 15 points. Each of these courses listed here will receive points based on the grade earned. A is 3, B is 2, C is 1, etc. So a total of 15 points available here. We have a DH 100 course. It's an intro to dental hygiene course that you can earn up to 5 points for if you complete it with a grade of A. You must complete all of at least 28 of the required 44 prereqs. So 28 of those have to be done before you apply. There is a prerequisite verification form to fill out with a detailed list. You get an additional 2 points on your application if you have completed all of your prereqs, all 44 credits before the application deadline. For a dental assistant, you must complete 9 of the required prereqs, and that prereq verification form is here. For GPA, this is one of the larger ones. So that 2.5 minimum GPA will earn you 9 points. That 3.67 to 4.0 will earn you 25 points, and it titers down from there. So you can do that calculation. Those calculations are based on the prereqs required for the program, not your overall GPA with the college. So it will only consider the things that apply to those 44 credits of dental hygiene. You get an additional 2 points for having a prior degree, being an in-district resident for Jackson or Josephine County, being a veteran or having active military status, and you can earn up to 15 points for paid hands-on patient care experience within the last 5 years, supported by a current unencumbered state license or national certification. So if you have been say a dental assistant for the last 5 years and you have worked over 800 hours of paid experience, you have up to 15 points on that application there. So there is a point given for alternate status. If you were an alternate last year and are reapplying this year, you do get an additional 5 points. This also walks you through when you do your application. The application fee is non-refundable, must be paid to RCC Marketplace before you submit your application. It's a $25 fee for dental assisting, a $100 fee for dental hygiene. Payments are open as of now. Save that receipt as proof of payment. So you're going to gather and perform all of your RCC dental program pre-application procedures. Okay, so you're going to go back up here, make sure that you've done everything on this list for the RCC pre-application, get that all together. You're going to submit your official transcripts. If you haven't done that already, follow that hyperlink to do though. To do that, a copy of your marketplace receipt that we just talked about, your military documents, healthcare worker license. So if you're an FDA, if you're a CDA, and then this is your link to that application right there. So you would click through that. If you are accepted to the program, you will be, if you are selected for the program for a dental assistant, you will be invited back to do an essay. If you are selected in the top 30 applicants for dental hygiene, you will also be invited back to complete an essay. It is worth additional points, and then the top 20 applicants with the highest points overall will be selected for the program and invited to join us. After you are selected, that is when you pass your background check, complete your drug screening, and submit the proof of those immunizations and that current American Heart Association CPR card. Okay, so really making sure that you have everything ready to go before you apply is critical. Read through the information, make sure you've gathered all of that documentation, and go ahead and submit that there. I'm going to stop sharing my screen, and I'm going to open it up to everyone for some questions here. And again, that dental code is, for those of you who are looking to apply, that dental code is Scrubs. So for those of you who want to stick around and ask questions, I am happy to do so. If you want to pop some questions in the chat, you are welcome to do so. And then what I'm going to do in the chat as well to everyone is I'm going to type in my email address here. And if you have additional questions or need to book a time to meet with me, you can do so. I'm happy to look over your transcripts with you, help walk you through how you calculate those points, and just give you some feedback going into the programs. So that tdenda@roguecc.edu, that address is in the chat for you guys. So the first question I have coming in the application for dental hygiene, there's a section to enter grades. They're for science classes. Do you enter your lab grade, or lecture grade? You may enter the higher of the two. Great question. Perfect. Any other questions? And I am going to make sure everyone who wants to can turn on their microphones. Okay, so anyone who wants to unmute themselves can just go ahead and pop that hand up first so I can kind of call on you and we can keep a little bit of semblance of order here. I do have another question from Lori in advising. Thank you, Lori. The GPA goes off of the prerequisite GPA. So it's not your cumulative GPA. So say you took a smattering of classes earlier, that GPA was lower. When I pull up the transcript for dental hygiene specifically, it just calculates those prerequisites and gives you that GPA. Great question. Another question I have, any hygiene classes coming to Redwood campus at all? In the future, we may be able to open that up as a satellite site for clinical practice. Currently, we are not getting that accredited for its own separate hygiene program. OChem, does that replace chemistry? That Chem 104, that's a specific question. That Chem 104, it looks like that is the required prerequisite. Let me double check that for you guys. Okay, so yep, it's Chem 104, Chem 104 lab. So that is the required prerequisite there. So the dental assistant program, it is on Table Rock as well. So question from Areli, will the dental assistant program be at Table Rock as well? Yes. So the Table Rock campus currently supports the CODA accredited version of the program, which is the 3-term program. We have a current cohort of 11 students who are in their 2nd term now. So that one runs fall, winter, spring. You graduate after the spring with your CDA and your EFDA, and that is on the Table Rock campus. The CODA accredited program will also be coming to the Grants Pass campus. Currently, we are only running that 2-year program there. Okay, Lori, it looks like we have a question from you. What can I do for you? And let's see.
Thank you. For the chemistry question, I don't know what OChem is, but I do know if you have a higher chemistry, that those can be considered. So submit what you have, and we can check with student records on that to verify if the chemistry that you did take will fulfill that chemistry requirement.
Great. Perfect. Thank you, Lori. Appreciate it. Okay, Kenzie. Let me see if I can get you unmuted here.
Hi, can you hear me?
Hi. Yeah, what can we do for you?
So I had a question. Last year when I applied, I had the document signed by the dentist I worked for the work experience,
Okay.
and I got like the top hours. So I was just wondering if I had to have him re-sign it for the new year or if I could just use the old one that he signed last year.
That's a good question. Why don't you send that to me in an email and I
Okay.
can double check with our program advisor.
Okay. Perfect.
Thank
Thank
you.
you.
Good question. Yeah, I do know it does have to be within 5 years. So as long as it's within the 5 years, I think you might be okay, but I would love to double check on that for you.
Okay. Perfect. Thank you so much.
Yes, of course. Okay, so I have another question coming in. If you haven't done the pre-dental hygiene class, can we do that this summer and get those points still? I do not know if it will be held in the summer. It should be held again in the spring at least. So double check in the spring. So it's kind of by availability there. But yes, absolutely. If you want to send me that question via email, I can forward that on to our dental programs director as well. Um, so I have a question from Isabel. How many students are accepted? So for our hygiene course cohort, it is 20 students total. For the dental assisting programs between the 2 campuses, we have space for 30 dental assisting students in both of our CODA accredited portion. And give me just a second. I'm trying to find my mouse, which might have died. Okay, Denise, I'm going to go ahead and ask you to unmute. Looks like you have a question there for us.
Yes, hi. Will you still be able to do a background check even if a student doesn't have like a social, like with an I-10 number?
That is a great question. I haven't heard that question before, and I don't know the answer. If you will send me an email, I would love to get that answered for you.
Thank you.
You're welcome. Okay, Morgan, go ahead.
Okay. I was wondering if Oh no, did I leave? Oh, okay. Sorry. Um, are we, as hygienists, are we going to be trained on nitrous also, or is that kind of something we'll have to do on our own?
We will be trained on nitrous. We train our dental assisting students on nitrous as well.
Cool. Sweet.
Great question. Thank you. Okay, any other questions? Okay, again, my information is in the chat, that email address, that tdenda@roguecc.edu. I am available for one-on-one advising, taking a look at those transcripts for you, partnering with our advisors like Lori, who popped in with her question regarding the organic chemistry higher level requirement. So if I don't know the answer, I would love to partner you with the person that does. And yeah, love to get your questions answered. And the more you ask, the more I learn too, so that I can better help other students. So don't be shy. And when you go to my email, when I respond, there will be a link that says book with me, and you'll be able to select a just like a one-on-one chat for 15 minutes or so. We can take a look at those transcripts, talk about the selection point process a little more in detail for those of you that are interested, kind of where you fall on that selection point scale compared to others. I will say the lowest score for a phase one applicant last year that ended up being accepted into the program, I believe was 43. So that would mean, 25 GPA, the 25 points for GPA, the 15 points for those science classes, and an additional 3 somewhere else. I did hear from my dental program director that anyone wishing to apply and earn an additional point on their application can do so by being a patient in our dental hygiene clinic. That'll give you exposure to the types of things that you will be doing as a dental hygienist. So if you are interested in being a patient, you can go on our website, that dentalinfo@roguecc.edu, and inquire about being a patient in our clinic as well. And then I have I have a question here from Melissa. Where do we enter that information on the application if we are a patient? That's a good question. This is brand new. I do not know that there's a space for that yet. But when you come into the clinic and you complete your visit as a patient, there will be information given to you so that you can add that to the application. Great question. Okay. Yeah, if there's no other questions, we are all set. Thank you guys so much for participating. I really appreciate it. Again, that code for the application is Scrubs. I'm going to go ahead and stop the recording now. You guys have all been wonderful. Thank you for your great questions. And I'll stick around for the next few minutes and answer any questions I can one-on-one. Thanks so much, you guys.